So I started my journey of robotics 4 years back in 2018, following the footsteps of Dr. Vaidya. So we started using Navio handheld robotics for doing robotic knee surgeries in June 2018. And so what are the burring options? So my talk is a very short talk, so I'll just go in a little detail of what are the various options we have for burring. So first options, we have a burr cut guide, which was the primitive option of doing a robotic surgery. Then there's an all burr technique, which I think a few surgeons are still doing and they love doing it. And lastly, it is the femoral distal burr technique, which is my preferred choice. So why will we talk about that? So primitively, robotics had burr cut guide. So what we used to do is we used to make two burr holes with the robo. And through this, we used to attach a jig and then connect it for a distal cut. So this is how we used to take a distal cut, like a navigation distal cut. So instead of using a free hand, you use a burr hole with the robotics and then make holes in the distal femur and align the jig and take the cut of the distal femur with the help of a saw. The other technique is a burr all femur, which I have tried but did not like it much. It is a little more time consuming, plus it gives you a fatigue to your hand. So here what we do is we drill the whole bone cut with the help of the burr. And sometimes it's very difficult to reach the posterior aspect of the femur. So you have to actually drop your hand down and do it. It takes time initially, but in the hands of experts. So I know of a few surgeons who are doing it very well, and so they do it and they are very happy. So coming to my method of choice, which is a distal burr technique, here what we do is we burr the distal femur with the help of a robotic device, and then we align and we make two pilot holes and we align the jig for taking the rest of the distal femur cuts. So we use a 5 millimeter cylindrical burr to drill the distal femur. And we cut the distal femur with the help of the burr, which is a cylindrical burr. I use it on a burr mode. And we make two pilot holes. On this pilot holes, we then align our APCC block and take the further cuts of the distal femur. So this is a flow chart. How do we go for it? So first step is to drill burr the whole distal femur. We've seen various demonstrations how we do it, and then we make two pilot holes and then align the jig to it. The tibia, we do it routinely like a normal navigation tibia, or we can make a burr cut guide to the tibia and cut the tibia with the saw. So this is what distal burr technique is. So a small video demonstration, I'll just show you how we do it. So we've already burred one of the condyles. Now we're doing the second condyle. And it's pretty fast. So the advantage of doing a distal burr is it's pretty fast, and it gives me an accurate cut. It does not, I have no fear that my cut will be wrong or deviated. Even if it's a hard bone, it will be very perfect because it's using the robotic assistance. So for hard bone or for a soft bone, the cut would be accurate. And it will only remove the part which is we want to remove. And then we change to a speed control with which we make two pilot holes to align the femoral cutting jig. And we use a targeting device also, so the robotic has a targeting device option. So we put that targeting device and we can align our burr guide to make perpendicular holes to align the femoral jig. And then routinely we take our APCC cut with the help of the block of the APCC block of the company. So this is what a distal burr technique is. So there are various papers which demonstrate why robotics is very important in avoiding errors. Most of the errors are which we encountered in doing navigation knee or a normal knee is through the saw, because once the saw crosses a certain amount of distance, there is a chance that the saw will scuffle off and you'll have errors while doing cuts. So this is a cadaveric study which was published in the journal, and which showed that when we use robotics, the errors was very less. It was less than 0.1 and 0.5 degrees, and in flexion also it was very less. And there's one more paper which demonstrates that cutting errors while you're preparing femoral components in total knee arthroplasty, so which states that around 1 to 2 millimeters of error can happen when the saw blade is cutting a posterior part of the condyle. And this can be avoided by using a distal burr technique. So why distal burr? Because it's a hybrid method. It uses handheld robotic tool to prepare the distal femur and 2 pilot holes. It accurately positions my femoral cut guide so that my rotation also is perfect, and it speeds up my surgery, so it reduces my operating time. Thank you.